Welcome to tonight's webinar, Symptoms and Treatment Options for Recurrent Urinary Tract Infections, presented by Katherine Olson, Certified Physician Assistant. Katherine Olson is a certified physician's assistant who has practiced with Colorado Urology for 9 years. She sees general urology patients both by telehealth and in-office appointments, and will serve as the new dedicated telehealth advanced practice provider for UTI patients, along with many other conditions. Welcome, Katherine.
Thank you for that introduction. As Jenny said, I'm Katherine Olson. I'm a physician assistant with Colorado Urology, and I appreciate you all taking the time to join me today. And we're going to touch base on urinary tract infections, specifically recurrent urinary tract infections. Let's break this down a little bit. The urinary tract starts with the kidneys. The kidneys filter urine and are attached to tubes called the ureters that drain the urine down into your bladder, which functions as a reservoir. It holds the urine until you're able to urinate or wish to urinate, hopefully. Urinary tract infections can be upper tract, which is kidneys, called pyelonephritis, or lower tract. And for the purpose of today's talk, we'll say that lower tract is really just the bladder. Some people may refer to bladder infections as cystitis, UTIs, urinary tract infections, bladder infections. They all roughly are going to mean the same thing for today. In order to have a urinary tract infection, you really need two things. So you need symptoms, and then you also need a positive bacterial urine culture, and that gets you a UTI. There are lots of different symptoms of UTIs. They're the ones that people think about frequently. So it burns when you urinate, you have more frequency, more urgency, so you've got to go all the time. Maybe you're not urinating much, but you feel like you do. Some patients might have sudden onset of leakage of urine. Your bladder hurts. You could have low back pain, blood in the urine. If you start to get things like fever, chills, pain up in the upper back in the kidney region, then we worry about those upper tract infections I was talking about. But there also can be different types of symptoms of UTIs that patients may not necessarily associate with a bladder infection. So these can be things like changes in mental status, meaning that you might become more confused, more emotional or tearful, and sometimes even just falling down unexpectedly. So these tend to be our older folks, but if they start to show any of these signs, so confusion, unexplained falls, lack of appetite, we want to check them for a bladder infection. So that's half the equation. The other half that I was talking about was that you need to have bacterial urine testing. There's a couple of ways to do this. There's the urine dipstick, and these are found in almost every provider's office. You can also buy them over the counter. So this is not a for sure culture, but it's a preliminary test. And so you pee into a cup after you do the proper kind of wiping of the vaginal tissue to make sure you get a clean catch is what we call it. So you pee into a cup, dip it, and see if it looks like you probably have an infection. As a side note, if you have these dipsticks at home as patients, make sure that you're keeping the lid on the container and the container in a dark area and it hasn't expired. If they're exposed to light, it will alter the way that they are read, and then they may not get an accurate result. So you can do a urine dipstick. You come into the office, we dip your urine, it looks like it's an infection, and then we'll send it out either for the typical urine culture, and that's the middle picture. That's where they grow your urine in a little petri dish of bacteria food in the lab, and in about 48 hours, we can tell you yes or no for an infection and what antibiotics will work. Or there are some newer tests available, molecular urine cultures, where you come into the office, you pee into a cup, we send it to a lab, and they run it through PCR testing that's looking for DNA and antimicrobial markers. It's a much, much more sensitive urine culture. That means it's going to pick up lower levels of infection. Not everybody needs this test run, but it can be helpful if maybe you're one of those people who have symptoms, but not a full-blown traditional urinary tract infection, then the molecular culture can be helpful. So what's a recurrent urinary tract infection? That is when you get 2 or more UTIs in 6 months, or 3 or more in 12 months, which would be plenty for those of you who have had UTIs. And the big question, why is this happening? There are a number of different reasons this can happen, but a big one's anatomy. So men can obviously get urinary tract and recurrent urinary tract infections, just like women. But because of anatomy, women are more predisposed to getting these, which is why I put up a picture of the female anatomy. If you take a look at the picture, the urethra right here is really close, and that's the tube you urinate out through the bladder, is really close to the vagina, which is close to the rectum. So it doesn't take a whole lot of friction to move the bacteria that's naturally kind of found around the exit of the rectum up into the urethral area. And from there, it's a pretty short shot here to get up into your bladder. So sexual activity is a really common reason people will get recurrent urinary tract infections, women. We used to call this honeymoon cystitis. It's a pretty outdated term, but the idea still is the same. Young women becoming sexually active are just going to be predisposed to getting more UTIs, frankly, because there's usually more sexual activity. So that is one reason. From an anatomy perspective on the other end of life, when women start to lose estrogen or become postmenopausal, then the anatomy changes will also set them up for infections. So once you lose estrogen, the pH that's naturally in the vaginal tissue changes. So the pH changes in the vagina, which stops supporting lactobacillus in the vagina. And lactobacillus is one of those healthy bacteria that helps prevent bad bacteria like E. coli from getting up into the bladder. When your estrogen level is low, that vaginal tissue also becomes thinner and more fragile. And it's a lot easier for you to get like a micro tear or a little abrasion, especially during sexual activity, that can help set you up for UTIs as well. So there's a lot of other things too that can cause recurrent urinary tract infections if you've had surgeries on any of the area of the urinary tract. So surgeries on your kidneys, your prostate, your bladder, that will set you up for infections, possibly, not necessarily, but it can. Sexual activity, which we touched on, genetics. So we know that some people are just predisposed to getting urinary tract infections. You know, their mother got them, their aunt gets them, their sister. We're kind of working out the details on that still, but that certainly is a factor. Physical things. So if you have a kidney stone, that can act as a nidus or a source of infection for the bladder. Catheters can do the same thing. On the flip side, catheters also keep the urine out of your bladder. So catheters are both a slight increased risk for infection, but also a really necessary treatment for urinary retention. And diabetes, that's a big one. So diabetes, compromises the body's immune system. So it's not able to get rid of the infections as easily as we normally would have. But also, if you have excess sugar running through your system, a lot of that sugar gets filtered through the kidneys and then down into the bladder. And when that sugar is sitting in your bladder, it's basically like a buffet for bacteria. So that will be a setup for infections. And the last one, the one I saved for last, was antibiotic use. So yes, we treat infections with antibiotics, but we also know that the more antibiotics you use, the more likely you are to possibly get infections, because an antibiotic will get rid of your bad bacteria and the good bacteria. And we all have good bacteria inside of our body that's helping to kind of balance out the good and the bad. It's like a check and balance. So that's a brief overview of some of the big reasons that you can get recurrent infections. How do we treat them? Well, antibiotics. So if you have a symptomatic bacterial proven urine culture, then we need to give you antibiotics for that. If it's reasonable, we'll want to wait a couple of days for your culture results to come back, so we make sure that we have you on the right antibiotic. But while you're waiting, there are things that you can use: Tylenol, over-the-counter azo, or prescriptions like Pyridium, Urabel. Those are all bladder numbing agents, and that will help a lot with those painful symptoms of the UTI. Why don't we just give you antibiotics right away? Basically, we want to make sure that we're not causing you more harm. The big one is the risk of antibiotic resistance. And I think a lot of people have heard about this. So the more antibiotics your body's exposed to, the higher the risk is that the bacteria in your body will basically outsmart the antibiotics, mutate and change, and they no longer respond to those antibiotics. And you can run the risk of not being able to be treated for your infection with any oral antibiotics. And you might need IV, or the situation that none of us want to see is when we don't have any options. So that's one reason that we really kind of limit antibiotics if possible. Also, another situation called C. difficile or C. diff. And this is a gut infection that's often caused by antibiotics. So like I'd said earlier, antibiotics get rid of the bad and the good bacteria. And if the bad and the good bacteria is gone, then nothing's keeping that regular bacteria in check, and you can get an overgrowth of C. difficile, which can be a really serious, sometimes fatal gut infection. Great. These are infections. These are why they're happening. Make them stop. So prevention is huge here, and there's a lot of things we can do. So cranberry and D-mannose, those are a lot of the old standbys that most people have heard of as far as being preventative for urinary tract infection, but we know that they actually do work. So cranberry and D-mannose both have some properties that help prevent bacteria, specifically E. coli, which is the bacteria most people get, from really binding and sticking into the bladder wall. It's funny here on this picture. So cranberry juice won't work. So don't waste your time drinking cranberry juice. You'd have to have gallons of it. It really isn't going to work. You'll need the cranberry pills in order to get kind of the active component of the cranberry that's going to be helpful against UTIs. There's also some literature showing that vitamin C, 500 milligrams taken twice a day, along with a daily probiotic, can be helpful as far as kind of sterilizing that urine and getting the good bacteria back into your gut. So these are over-the-counter ways to help. There's a lot of prescription options. My personal favorite is methenamine. So methenamine mandolate or methenamine hippurate is an old sterilizing agent, not an antibiotic, but it's a pill you swallow, gets into the urinary tract, and then it sterilizes the urine and causes basically the urine to be less hospitable to bacteria. So it works really well. There's estrase or estrogen creams, which again, just put that estrogen back into a low estrogen state tissue. And that can be really helpful as a topical. And yes, antibiotics. In the right situation, taking a really low dose antibiotic after intercourse, or rarely I'll treat a patient with daily antibiotics for a short period of time, can help kind of stop that cycle of recurrent urinary tract infections. And then there's surgeries. So maybe if you are a male with a big prostate that's blocking you up, or you have a kidney stone, we need to get rid of those so we can clear up the obstruction in your urinary tract. And there's something called vaginal lasers. Mona Lisa lasers are one type. And these help basically rejuvenate that vaginal tissue like it was in a higher estrogen state. So what happens if you come into our office? So if you come in initially with a history of UTIs, whether it's your first one or it's recurrent, we're obviously going to want a urine sample. That's really helpful. And then usually we'll do a few other things. We'll check your urine, we'll scan your bladder, which is just a little bit of gel and an ultrasound on the outside of your bladder to make sure that you're really emptying out. We'll take a thorough history. So this is the part where if you have old cultures from those positive bacterial urines that I was talking about, bring them with you. We're nerds. We love that data. It's going to help us a lot as far as getting you to a better place. And then we'll probably do a physical exam. For men, check your prostate. For women, do a pelvic exam. And sometimes we'll talk about whether or not we need to do some imaging or take a look inside your bladder. Great. So that's your initial workup. Sounds like a lot. Here you are a couple of weeks, a few months down the road, and you have another urinary tract infection. You'll give us a call. We'll have you drop a sample at our office, and then we'll see you either in the office or likely virtually online so we can help treat your urinary tract infection that day as it's happening. So this is just a little bit of a breakdown on the nitty-gritty of recurrent urinary tract infections. And I appreciate you taking the time to be with me today, and I look forward to answering your questions.